Have you ever experienced sensitivity and or pain when you eat or when you drink something cold? Has that ever been your experience? Because many people, when they come to the office, their main concern is that, they experience hypersensitivity. Sometimes also they experience pain because they have eaten or drank something cold. Today we're going to talk about 3 reasons why your teeth may hurt when you eat or drink something cold. So we're going to essentially answer that question so that you may be enlightened as far as why could it be that your teeth are hurting when actually you experience something cold, like experience sensitivity on your teeth, and what are the reasons, or what is the reason? Number 1 is that you can experience sensitivity because your enamel, which is the outside surface of the teeth, which is more like an insulator, it insulates or protects you from actually feeling, that sensitivity or cold. So if it has been worn out, maybe because you have thin enamel, or maybe because you're grinding your teeth, or maybe because, your gum has receded, and the part of the tooth that's under the enamel, which is called the dentin, which is also more sensitive to temperature, is exposed. That would be one of the reasons why you may experience, that sensitivity and or even pain when you eat or when you drink something cold. So depending on the reasons, for example, if it's caused by grinding, so your enamel has been worn out because you're grinding your teeth, then your doctor would more than likely recommend an occlusal guard, meaning it's like a night, and that people usually wear at night, because at night is usually when they grind their teeth. Due to maybe stress or whatever other reasons. And so that guard is going to help them so that the enamel doesn't keep on chipping away, not even producing more sensitivity. So for example, if your enamel is really thin, we oftentimes recommend our patients to use a desensitizing toothpaste, such as Sentinel, and that's going to actually help you because it's going to desensitize, so make your teeth less sensitive. It's going to alleviate that sensitivity that you may feel when you actually eat or drink something cold. It could also be caused maybe because you had a feeling, and the feeling came out, and so if the feeling came out and you experience sensitivity, then once your doctor diagnoses that he or she is going to be able to do a new feeling for you, and that's going to actually alleviate or treat your problem. So that can happen where you can have sensitivity and or pain. I remember me myself, I had braces, and I believe I ate something that I wasn't supposed to, so whatever I ate was hard, right? So it actually caused my bracket to come off because I had actually brackets and wires. So when it came out, it actually chipped part of my enamel, and then the dentin was exposed. Oh my gosh. And I'm one that's more like on the sensitive side. So it was excruciating, but it was so painful. I remember going to the doctor to see what was happening. Thank God I didn't crack the tooth, but definitely my enamel actually was on the bracket, and it was so painful. So yeah, even with that, when you have brackets and they tell you don't eat chips, don't eat corn, I don't eat popcorn, things like that are hard, take heed. We tell you that for a reason. I actually happened to eat that. Yeah, and I didn't do it afterwards, but we tell you that for a reason. But definitely my enamel was exposed, and I was so much pain, such sensitivity. And thank God a doctor was able to do a feeling for me. Thank God I didn't crack a tooth. And so yeah, the doctor was able to, a dentist was able to actually help me out. And thank you for that, doctor. So that's one of the reasons why you may experience sensitivity and pain. Another reason why you may experience sensitivity even or pain will be because your tooth is cracked. So if your tooth is cracked, it's kind of like the same thing, right? Where the dentin is exposed and you actually end up having pain. You start having pain. And with the cracked teeth, right, it's going to depend as far as what can be done. The doctor would have to assess how far that catch actually goes. With some people, they may be able to just, with the crack, like maybe do a crown on the tooth, or, some people, if the crack is intense or is more like severe, it may have affected, like gone down to where like you need a root canal, and after the root canal, you want to do a crown. So, that's why we tell the people to be very careful on what they eat, and we may listen to the video that I did, last time about cracked teeth and how to avoid having them. That's going to help you, because in some instances, yes, you may be able to get a crown, or you may be able to be treated by having a root canal and a crown. But in some cases, if the crack is like has reached all the way to your roots, you may end up losing the tooth. And at that point, we're talking about restoring the tooth with something else, like maybe a bridge or maybe an implant, right? So you want to be very careful as far as like what you actually want to do to prevent having cracked teeth. Then the last thing that I want to talk to you about, number 3, is a tooth that has sensitive or extreme pain because you have cavities, and the cavity has reached either the dentin or even further. If the tooth has reached your nerve, then yes, you'll be in so much pain. You'll be in so much pain, because once the cavity has reached the nerve, that's very, very painful. And with that being said, depending on the extent of the cavity, you may be able to maybe have a root canal and have the tooth treated, or maybe you may end up losing the tooth, just like with the cracked tooth we said, you may end up losing the tooth. And if you do lose the tooth at that point, then we're looking into replacing the tooth that you're missing, because once you actually lose a tooth, you want to replace that tooth, because if you don't, you can end up experiencing like a shifting in your teeth. Some teeth can move forward, some teeth can move sideways, and then you're no longer able to have like a normal bite, and that can cause you to need even more treatment, like maybe realigning the teeth and things like that. So those are 3 reasons why you may experience actually teeth that are sensitive to cold, or teeth that are painful. It could be that your enamel is thin, or like that the part of the tooth under the enamel is exposed, and then due to anything like maybe a recession or a tooth that's missing a filling or whatever we talked about, and then you end up having sensitivity to cold. Depending on the situation, many different treatments can be recommended. Could be toothpaste, could be some restoration, just treatments. Another thing is cracked teeth, which you really want to avoid, and then the other thing is having cavities. That is the reason why, honestly, you want to make sure that you keep going to your dentist, so that your dentist can assess issues ahead of time, especially like if it's a cavity. Once it becomes really extensive and it reaches the nerve, you will be in so much pain. It can even lead to dental infection, and you don't want, to go through that. So because teeth are very important, the positioning of the teeth are very important, and you definitely want to keep all your teeth if you want. As much as of your teeth, or all your teeth, because nowadays, we're no longer in the position where, because you have an issue, the tooth has to be yanked out. Or extracted, in better terms. So, just be mindful of those things. There are solutions for your sensitivity or for your pain. So make sure that, if you experience that, you definitely want to go see a dentist so that they can help you. And if you are in the area where we are located, which meaning in the big Dallas-Fort Worth area, we are based in Arlington, you can give us a call, 972-213-0202. And also, you can secure or request an appointment on our website, www.healingwingsdental.com. And we are located at 4101 West Greenwich Boulevard, suite number 317 in Arlington, zip code is 76016. Should you have found this information pertinent or important, please don't hesitate to share it with your friends, your family members, your coworkers, your colleagues. whoever you know, especially if they tell you about the situation that they are facing. And please don't hesitate to subscribe to our channel, to like or follow us on our handles. That being said, I wish you a fantastic rest of the day. Be blessed for now and make it a positive. It's within your power to do so. Have a good one.